Hello guys, it is buyout day today. Jason and Tanya are out lobbying in Texas, so they can't be here for buyout. So I'm going to be filling the place with my dad and making this video for y'all. Hope you enjoy it. The horses are about 5 minutes out. Let's go. All prepped and ready for the horses. They're about 3 to 4 minutes out. They're almost here. And we'll see how it goes.
Can we get some more piles of hay thrown out? Hey, Sydney. Okay. Can you guys let Sydney out and let's put that horse with you? Okay. Yeah, if you want to. Okay. I'm going to Ray. Got it. Okay. Okay.
All right, we gotta get some water over here.
Really painful.
This is gonna be 173.
Easy. Okay, resting.
What breed would you say?
I call this
No tattoo.
What do you mean? We just have one.
that pony. I'm gonna do next. The horses just arrived. We have several that appear to be in pretty significant discomfort. So we're administering pain medications. I have one that has a suspected fracture that we're gonna take radiographs on. All right, you wanna stop there for 1 second, Cody?
Is that?
Back condition can cause discomfort, but so it's not painful. Yeah, I would call it the left call it like a lateral. Girl.
So Dr. Lydia, is this our first?
This mare we pulled right away. She appears to have a fracture or a dislocation of this left front. Her resting heart rate is 62. Upper end of normal for horses is in the upper 30s. So we got some pain medication on board right away. I'm gonna do a physical exam while we let those pain medications kick in, and we're gonna take some x-rays. Okay. Good girl. She has reduced GI sounds. In both of her upper quadrants, she's very reactive to palpation on her back, and she's got a lot of scarring. She has some back pain, like even just very lightly touching. She doesn't have active digital pulses, but she does have some effusion in the support limb. So horses carry 60% of their weight in their front legs, and this mare is holding maybe 10% over there, about 90% over here. So this is why horses with a fractured leg have a really difficult time recovering, is that the other 3 legs just don't compensate well.
Josh's not up here though, because he's still using it.
Okay, big girl, we're just gonna take some pics. I need to pick, yes, I'm sorry. Got a little bit of yikes.
Even that looks like
Yeah.
weirdly.
This
Detached.
looks detached. Yeah, let's. Good
Um,
girl.
Do you want to try and put her on the block so you can get the foot, or?
I don't think so.
Okay.
Back, if that's okay. She is
Of her back, okay.
extremely reactive.
What do these x-rays look like?
They look depressing, and I'm happy to show them to you in a second. So frequently what we see with these guys is a single lesion, like there was a fracture. In this mare's case, I think there was a severe soft tissue injury that wasn't addressed, and she's got severe osteoarthritis that's proliferating, so she has crunchy bits of bones where they shouldn't be, and the soft tissue structures that she does have, yikes, she's got some back lesions. The structures that she does have, instead of sliding in their smooth, lubricated tube, as they should be, they are not properly aligned or supported. But I'll show you the images in just a second. This one's gonna be diagnostic. Dr. Marina is gonna be reviewing these radiographs, but all of the irregularity here, all of these divots and chunks out of this bone should not be there. This irregularity, all of the areas where you see kind of a spongy, moth-eaten appearance is abnormal and indicates severe advanced disease. So what's really heartbreaking is instead of that joint just having one fracture that healed that way, she has functional joint space and she just has crunchy bone grinding on bone, and it goes pretty far down in this foot. So you can see all of the osteoarthritis on the sides as well. She also, I suspect this is why we have, so this lesion is right where she was very, very reactive to palpation. And you can see the caps of these vertebrae. This is a normal finding in horses, but this appearance right here where these vertebrae are touching each other and kind of lytic from rubbing each other is not normal. And those are kind of that one's not diagnostic, the major findings. This poor girl. And it looks very old. She's got a mild kissing spine lesion in her lumbar spine. This looks pretty normal. Yeah. Poor man.
You want me to go ahead and get the main? Yeah.
If you can, that would be lovely. Came down to 48, which is much better than 62. And you can see in her face, see how her face is still really tense right here. So sometimes chronic pain, horses, you know, this is better than it was, but this feels like it's been here for a long time. And you can see the contracture of these tendons right here. So these bones aren't lined up the way they should be, and I suspect that she can't even move it. She is unable to straighten this leg. She just can't do it. In about 8 weeks. So even a severe soft tissue injury, if you support the horse through it with 2 months of appropriate post-injury care, you can end up with a very normal functional limb. And again, I'm making assumptions based on what I have seen, but I would call this horse a severe proliferative osteoarthritis, secondary to a soft tissue injury, not a primary bony fracture. But it's so severe and it went on for so long that this horse can't straighten her leg because the bony proliferation and the arthritis is so bad in this area that it's just little crunchy bits of bone that are touching other crunchy bits of bone. So the pain was so severe that she avoided moving the leg, and now she cannot move the leg. You're a good girl. I know, I'm sorry.
Overall, how are these horses compared to other groups that we've seen?
Man, we didn't have any down on the trailer, so that's always really heartbreaking. So I'm thankful for that. It does look like this group is similarly high levels of long-term pathology, and that's always tough. There's one mare that looks like she just needs an enucleation, but she also has some malformation of one of her legs. We got a draft horse that is in really bad shape, so I wish I could say they all look great at first glance. I'm guarding my heart. Again, these are horses that were intended for slaughter. They were in a slaughter auction, so yeah, I've only looked at one so far, so I don't feel like I can accurately answer that, but they're a pretty heartbreaking, rough-looking group.
You're sitting with my mask like you're feeling.
Let's go on the rubber and stop right there. Okay. You're not. I gotta poke you. I know. I know. You're gonna be okay. Hi, sweet thing. I'll help you feel better, okay? Good girl. Very good. I'm gonna try to disconnect and just pull blood, so I don't have to poke again. Easy. I don't have my mouth. There we go. I know. I just don't want to have to poke you again. Good job. I know your feet hurt. I'm sorry. Yes. Very old. I don't actually know. This is a little mare. I know that hurts. Mini mare is in her upper 20s. Her resting heart rate was in the 70s, and you can tell by the way she's walking, she's painful. She's trying to get weight off of those front feet, and this is a pretty classic. From the outside, it looks like this is a chronic laminitis case. So we're gonna take some foot radiographs. She did get pain medication right away, and it's just really difficult to tell from the outside, and we don't ever want to make a decision without those diagnostics. So we are gonna get some foot rads and take it from there. If you're watching this, that blood is just because I didn't want to poke her twice and I disconnected the needle. So her foot is not bleeding, but we're gonna take some foot radiographs. She has bilateral cataracts. So that's another indication of advanced stage. And she's very, very thin and a little bit dehydrated. So we're gonna get those x-rays. Okay, I'm gonna go put lead on. Yikes. Yeah, this looks just like the other one. You're so sweet.
Are you trying to do both, or?
I was just thinking about it, but I think I'm just gonna go for the okay, you can put it down. Oh, that medial lateral imbalance. Can we try for this other one? No, it's okay. I'm gonna just take the orthogonal. Hi, I know I had the cookie. You're good. That one did not take. Oh, so sorry. Good girl.
Standing on the block.
Yeah. You're so sweet. Good? Yes.
Okay, I'm gonna go help her.
If you guys wanna, she can get off the block now, yeah. If you guys wanna take a,
able to pick up, separate.
I think it's probably safe to say that she's been dealing with chronic pain for years and years. This is end stage laminitis, like truly end stage. She has active pulses in her feet. And what we wanna see normally is that this bone, the coffin bone, the face of that bone is a smooth parallel line to the hoof wall itself. And you can see in her case, not only has it rotated, it's also sunk, and she's got a severe slipper toe right here, and this is true on both front feet. Able to walk, but she's just severely lame on both of those front feet. Again, founder is usually manageable, especially if you catch it when it's acute. You can work with your farrier. It's often related to metabolic disease, and if you're watching this and your horse has had a founder episode, it's survivable. It's not easy, it's not inexpensive, but it is something that we can do, and we can manage horses with this condition as long as they have appropriate care for many years. And in this little girl's case, she's so far gone that her bones are almost fully resorbed in her feet. And there's nothing that we can do at this point to get her comfortable or keep her comfortable. And so we will provide her with many cookies and good pain medications and let her go. It's just always hard to look at these cases and know that no one advocated for this horse earlier in her life. Oh my goodness.
When a horse makes Dr. Lydia look short, you know it's a very, very tall horse.
Sydney, this might. This is another truly heartbreaking diagnosis. So this mare there's 3 different ways you can say it. You can say chronic progressive lymphadenitis, you can say chronic progressive lymphadenopathy, or you can say chronic progressive lymphitis. All of them are descriptive of the same condition, in which some type of inciting cause, it could be UV damage, it could be chronic wetness, usually it involves a secondary bacterial infection of the skin that causes a lymphatic reaction, so your lymphatic system is involved in draining stuff. Super oversimplification. What we don't know, but we highly suspect, is whether or not there's a genetic component. So this is a condition we see in certain breeds way more often than other breeds. I've never seen this in a non-draft horse, although it can happen. And CPL is a chronic, progressive, incurable condition. To date, there are no successful treatments for this condition. The treatments that we have are aimed at preventing progression. So if you have a draft horse and your vet comes out and you go, my horse's foot has just been a little swollen, down here by the feathers, and I ran it through a course of antibiotics and it just looks a little fat here, you can prevent this condition from getting to this stage with appropriate management. You can do compression bandages, you can treat the primary source, but once you get to the stage where a leg is cold to the touch and lumpy and firm, the damage is permanent. So there's nothing that we can do to make this leg smaller than it currently is. The other really heartbreaking thing in the cases of this disease that we see at Horse Plus are these chronic draining tracts. So this is not I stabbed my leg on something and I have a wound. This is, I have so much chronic infection trapped in my lymphatic system that I'm just chronically oozing and dripping. And some of these horses will literally drip lymphatic fluid. In my opinion, based on smell, that's also a bacterial infection. This can also be a neoplastic process, so that means cancer. So this can be a combination of all three of those things: inflammatory, cancerous, and or bacterial. So if your horse gets this diagnosis early, great. You can manage them with this condition to try to prevent additional disease. Once they get to this stage, it is game over. There's nothing that we can do for this mare to get her leg more comfortable and to get her to a point where it would be fair to ask her to continue living, which is just absolutely heartbreaking. I am so thankful that she didn't end up as someone's next meal. I'm thankful that we could give her pain medications. I'm thankful that she ended up here at Horse Plus. But it is heartbreaking. I actually haven't looked at her teeth, so I don't know how old she is. She doesn't look that old to me. This looks like her only problem. Other than this, her physical exam has been normal, and that just is really heartbreaking. So this case is a great, if you guys want to palpate, early CPL is pitting edema hot. Hot, hot, hot. End stage is hard, firm, and cool. You still have a little bit of a pitting edema, like I can push and a little bit stays, but for the most part, we are just lumpy and hard. And once we become hard, it is game over. Very reactive to those. Him down there and back because he's had banding long enough ago that I don't feel bad asking him to do that. Do you want to get this on? Survey. What? Let's cross it over really badly on this side, legs. See how his back legs are just crossing over each other over and over again. Can you stop him? Thank you. Good.
Why are you being so hyper?
Oh. Good job. All right, let's just give him a second and let that kick in.
He's just about 30 years old.
Oh, he's got some. A little bit. Sibby, when you feel comfortable and ready, we can walk him in here, but I'm fine with him getting a little sleepy before we do too much more. This handsome gentleman is a stallion. He is a branded standardbred. His Coggins said he was 22. Based on his teeth, I aged him at 30. He has smooth, super long lower incisors, super short upper incisors. He could have just had a rough life. We're gonna look up his brand and find out how old he actually is. Age is just a number. I don't like to make decisions based on age. However, if he really is in his mid to upper 20s, scheduling him for a castration is it's a big deal that I don't undertake lightly. He's been very respectful while he's been here, but we do know that after a certain age, stallions keep acting like stallions. But we also have a policy that we do not adopt out stallions from Horse Plus. There's no exceptions to that. So, he's been dribbling urine pretty consistently since he got here. I'm gonna try to get a little sample of that, take a look at that. We're gonna run some full blood work on him. We're gonna collect a nasal swab. I did sedate him because he was a little worked up. He was, you know what? Sydney, you just grab a tube. Sorry, hang on one second. He's really dripping urine right now. I want to try to get that urine. I'm going to come back, you guys.
We've paused the interview because he started dripping urine again. We're going to test it.
Yeah, you're doing good. You think you're cute. Okay. You look like we're 22, 23.
So when you're putting it up there, what are you looking for or listening
I'm listening to the gastrointestinal sounds. There's 4 quadrants, upper and lower on left and right side. And then up here, I'm listening to lungs. I do think there's fewer respiratory disease cases in these guys. Feel the right side of her neck, Sydney. Feels like she had a vaccine reaction or a reaction to something that somebody gave
Right here.
in that muscle. Look this side too. Wow. I would put money on that being.
And then right here under her mane.
Can you get her to take one step forward with this? Sorry, under her mane.
There's another
Perfect.
knot.
She has a severe heart murmur. Ooh. You guys want to hear this?
So if you
should
could
listen to
explain,
this.
if you could explain to the people watching at
Yes.
home what it sounds
so,
like.
normal heart sounds go lub dub. This horse's heart goes duh 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 duh. So we have 2 additional heart sounds with a pretty significant swoosh. Cardiology gets very complicated very quickly. In older horses, the most common thing that I've seen here at Horse Plus is valvular insufficiency. So what that means is the valves in a heart are designed so that blood, do you hear it? So that blood only passes in one direction. And when those valves get old or tired, and in some cases in young horses it can be congenital, they don't close as crisply. And so the swoosh that you hear often is the sound of blood flowing back into the heart where it shouldn't be. So anytime I hear a heart murmur of 3 or higher, I want to do a cardiac ultrasound because some murmurs can be benign and some can be very severe. We would not ever want to adopt a horse out from Horse Plus and have it have a cardiac event and pass very quickly. But without doing a cardiac ultrasound, I can't confidently characterize that murmur. So we're going to put her down for that.
So what kind of health problems can they get after having a heart murmur like that?
Oh man. Obviously your heart is critically important to all of your body systems. So in worst case scenario, if you suffer cardiac arrest and your heart stops doing its job, death very immediately follows. The most common organ that we see sequela to cardiac disease that's either acute or chronic is usually the lungs. And that's because blood goes heart, lungs, heart, back to the body. So that the lungs are the best friends of the heart. This mare doesn't have any lung sounds. Sometimes you can hear fluid buildup in the lungs and sometimes you can't. But you can have changes in blood pressure, you can have poor perfusion. The heart basically has to work harder and harder over time when something is abnormal. But it also poses a risk in horses that have jobs of carrying humans because sometimes horses can have a cardiac episode, and if it's under saddle, it can actually be life-threatening to that rider as well. So this is an older lady. She does need her right eye removed, and so that's something that we would want to do those cardiac diagnostics for sure before we put her under anesthesia for any reason. I like to do enucleation standing, so that really reduces that risk, but the ultrasound that we have will tell us a lot more about this mare's heart and whether or not it's benign, which just means, yep, we hear it, it's there, but it's not causing any problems. And a more pathologic type murmur, which means this is going to cause problems in the future.
Is there any way that you can prevent them from happening, or is it just...
It's a good question. I mean, I think caring for your body in general is important for cardiac health. In humans, the leading cause of heart disease, I believe, is dietary. So horses are herbivores. They're not out there eating Big Macs. And so horses are not as prone to getting high cholesterol and atherosclerosis and arteriosclerosis, those diseases where your blood vessels are affected because you consume too much salt or the wrong kinds of fat. But a good plan of nutrition and just general care is very important. But yeah, I think in general, cardiac disease in horses is not something that we would say this happened because this horse's owner didn't do what they should. And that's not always the case, but I think in this case it's incidental and it's because this is an older man. You're great. Good job, Mama. Moving down a little bit. I'm sorry, is that light too bright for your eyes? Ooh. I would like to retake that, please. This doesn't look good, ma'am. Take a deep pee.
Sorry.
It's her one eyeball, Sydney.
Or one good eye.
Will you just pull this a little bit to the side? Okay. Good.
So what are you looking for when you're looking at these?
That is a great question. These are not the most diagnostic radiographs. I'm looking for evidence that the two sides of the occlusal surfaces are wearing unevenly. They should be a nice smooth line. I'm also looking for abnormal spaces between teeth, or like this tooth could be a fracture or could just be abnormal wear. So obviously there's movement in this x-ray, so I can't really see this as fully diagnostic, but I can say this tooth right here is pointier than we want. We've got spaces between this tooth and a space here. Those are called diastema or diastemata. So sometimes in older horses, if the tooth is stable and you don't have gum disease, no big deal. And sometimes that causes chronic pain and we have food pack up in there and we get gum infections. So after this, the next step would be to sedate her, put the dental speculum on, put a headlamp on, get our hands in there and feel those. So she needs sedated oral exams. Yes. Sedated.
Definitely very abnormal, and it was cool to listen to it because I've heard
See me over here, okay? Have her sedated soon for looking at other stuff anyway, and I can do a better job. Today I just
So they're putting these on to prevent flies from getting on the wounds?
Well, so this is wound ointment, so it's gonna help promote healing. But yes, it's also hopefully gonna help flies from getting in. This is wound ointment, no, not fly ointment.
Lydia, what are these?
I think they're like fibrosis secondary to previous vaccines.
These ones you're making sure you don't have blood. If you have blood, take it back out and we'll redo it.
Hi guys.
An artery or a vein or something.
So what are you putting on the legs
This
now?
is called EquiSpot, and if you've donated this, thank you. This is on our Amazon wish list. This is a longer acting external parasiticide, so it repels flies. And it's really nice because here at Horse Plus, you know, we have feeders every day, but a lot of these horses have been traumatized. This mare is super sweet, but a lot of these horses have been very traumatized by people. So trying to catch them and fly spray them every day is not gonna happen. So we put this stuff on, and theoretically it lasts for about 2 weeks. And so that way we can make sure that they are not really irritated by flies when we turn them out.
So can you explain what your job is for today, your role, and then just say, I'm about to give her some viewers.
my job.
Yes.
Okay.
Sorry to pause you.
No, you're fine.
Oh, sorry.
You're good.
Okay, whenever you're ready.
So today I'm the primary horse handler, so I'll go out, grab them. Usually Nicole or Dr. Lydia will say this one's next critical one that you need to get. And then I bring them in and hold them for x-rays so they can examine them. I'll assist them if they need be. And she's about to get some wormer.
Yummy, yummy.
I like it. Sam.
Yes.
Oh, spit it out. Okay, so when Nicole is not in here and she's assisting with other things, we kind of try to keep that on track so we don't get too far behind. Luckily today we don't have as many horses, so it's easier to stay on track. But it's just everyone kind of fits in where they're needed, and we have a great team here, so we get through the horses pretty quickly.
Did well. She passed the exam. We're gonna do some additional intaking another day and just make sure that she's all good. But so far, so good. Just got done eating a short lunch. We're back up here, gonna continue the intake.
Hey Cody, before we go in there, do you mind just walking down and up? Those horses already had pain meds.
Can you hold for 3 seconds?
Sure.
Sorry.
No, Haley, I'm sorry. I should have waited. She's supposed to take the pictures. You look like you feel a little better.
There's a lot of scars on it.
If it's okay, I'd like to get
Footage of him walking down.
Sure.
Okay, is Liz not going to do pictures?
She's not back yet. Yeah, she is back. Okay.
Okay.
So this is the one that we gave pain meds before he came off the trailer. And he looks way more comfortable.
So when they're walking, what are you looking for?
Too many things to answer in one question. Lameness is sometimes really obvious and sometimes difficult. I'm looking for foot placement. I'm looking for whether there's an abnormal sound. I'm looking for a head lift or drop or a hip lift or drop, staggering, crossing over a feet. That is great, Cody. Thank you so much. Any other overt abnormality that's going to give us a clue if there is something abnormal about where the abnormality is, because we can't just take x-rays of every animal's body, nor would we want to. I'm just going to stand right here just in case he moves so that Haley doesn't get smashed. I don't think he's going to. You're such a good boy.
Didn't even
Yeah.
flinch.
Okay, Elizabeth, you're up with photos of this one. This, I think, is 178. 178. And we should be at
170.
branded standardbred 7BD13.
Okay, was it D? I couldn't tell.
7BD13. Yeah. Okay, Cody, if you're comfortable, let's go ahead and just bring them. I like these branded standardbreds because it gives me a chance to age them and then see whether or not I'm right or wrong. I would put this horse at like 19. Based on that too. 19 or 20.
You okay?
Oh, ouchie.
It's all right. Yeah, he's paying off palpation of that lumbar spine. I'm gonna try to palpate that lip on this side. Fly spray real quick if he'll let us. You're wanting face rest? boy. Oh my goodness gracious.
What you got?
All right, some major dental pathology, but let's keep going. Yes. Holy moly.
Oh, yeah.
That might be fixable though, honestly. No, it might be, because if this tooth is just crazy overgrown, because this one's been missing for a long time, it could be okay.
Well, look at the other ones behind it.
I know, I gotta touch it. Let's take a DP. Now, I'm not holding my breath. I'm just saying, like, if the teeth are stable and if it's an old trauma versus age-related.
Okay, bud.
So then,
Can you stay right here for just a second?
I know here.
That's not gonna be what we needed. That's gonna be way too distal. And too much movement.
You put your head down a little bit.
Yeah.
Not even close, my friend. Right there. And she's just gonna hold this weirdly over her head. Can you look back this way?
Good boy. Okay, I didn't like that from a staff safety perspective, because we probably all got some scatter, but. See what I mean? Like,
He's missing a lot of teeth.
he's
though.
missing a lot of teeth, but like, did they get pulled? So, do we have the speculum up here?
No.
I want to see that facial crest better. Can we try to take a DP where you're holding the plate right here and I'm shooting right here? Good boy.
Good boy. That's the best boy. Did you have to move at the last second?
Yeah, see? That's all related. There's no way that's not super related.
Yeah.
You guys want to see?
Yes. What are you seeing here?
So, what you see when you look at that horse's face is that his eye socket is sunken in, his facial crest is protruding abnormally, and when we're looking at x-rays, so this is the facial crest, eye socket is up here, we've got multiple missing teeth, and then the tooth on the bottom that corresponds to that missing tooth on the top is crazy badly overgrown. We've got a lot more going on over here. So what I need to do next is sedate this horse and put a speculum on, because if that tooth was surgically extracted by a veterinarian after this horse fractured his face, he could be fine. He could just need a dental. But if he has mobility and pain and disease in his gums or a hole here, there's a lot of things that could be going on related to this pathology that I can't learn from an x-ray. I have to learn from my hands, from touching. So he seems to be stable, but we want to make that a priority. I'm going to put him down to be sedated. We're going to put the dental speculum on, and I'm going to look in his mouth and touch all of his teeth and see if that's something that we can fix. His left eye does need to be surgically removed, but it's stable for now. So he's one of those ones like Dawson, the standard bred from our last buyout, where Dawson has somebody interested in adopting him, but before I'm clearing him for adoption, I'm going to surgically remove his eye so it's not a problem in the future. So that's not on fire. Let's take back wraps.
Sedating him?
Yeah, so I am sedating him because Cody went to get our dental speculum, so I can do a better exam inside his mouth right now. So I know. So let's look at these.
So you just took a picture or a x-ray
Yes.
of...
So just like I was talking about earlier with the lameness exam, palpation is free other than my time, and it helps us localize where the problem might be. So when I palpated this horse's back, he wasn't reactive anywhere except his lumbar spine, right before the sacroiliac joint. And what you see right here is that these two vertebrae are completely smashed into each other. And that's exactly where his back hurts really badly. Did you guys see when I touched his back? He was like, that
I
hurts.
think I might have gotten it, yeah.
Lots of cutaneous trunk eye reaction, kind of squinting away from. This was the horse that was in the trailer and wasn't willing to flex his head to turn. He was acting like he had pelvic pain. So I think this is probably related. So this is a horse that got Banamine 3 hours ago? Almost 4 hours ago, yeah. So that anti-inflammatory medication is like fully, completely on board, but he's still off on his pelvic limb. And I do want to be clear about kissing spine. We talk about it a lot. It's definitely not a deal breaker. Some horses have congenital kissing spine lesions. If they don't hurt, they're totally fine. This hurts a lot. But then in addition to that, we have some really abnormal dental pathology. Okay, so this horse had some kind of horrific accident. So these are the vertebral spinous processes. The withers are up here. So this is right where he has a bunch of scars up here. Hallie, look, this is another great example of arthritis. So see how that is nice and smooth? That's pretty normal. This is a little bit rough. All of this is osteoarthritis.
Oh, yeah.
Pretty badly. And this has gotten so severe that the bony proliferations are touching each other, even though the vertebral spinous processes are way far away from each other. This horse also has a big divot on the right side of his body where it looks like he had a fractured rib. And he's got bad scars on all 4 of his legs, but most significantly his hind legs. We didn't take x-rays of his right hind leg, but it is painful on palpation. He didn't want me to touch it.
Yeah, I can never see that. It looks like
And
really
then-
spongy on the sides. It's not straight.
That's exactly right. Great observation. This one is also touching a little bit, but that one doesn't hurt. So to me, if I can really ratchet on it and palpate and the horse is fine, I don't worry about it. But then his teeth, we have multiple missing teeth. So we're gonna put the speculum on and we're gonna palpate in there and see how severe that is. But this means he can't chew, because when horses grind their teeth, they have to be able to move the maxilla and the mandible in relation to one another. And this horse has a little boxy hole and a tooth that was left so long that it grew up into that hole. So there's no way he can chew normally. And iBody Condition scored him at a 2 out of 9, so he's quite thin.
Yeah.
Yeah.
What would cause arthritis to get that bad?
Chronic inflammation.
Okay.
Chronic unaddressed inflammation. Sometimes you can have an acute event, like this horse could have had a horrific accident and developed arthritis. I have knee arthritis because I played high school and college soccer and just didn't take care of my body. That could manifest from an animal being used, to pull a cart and not given opportunities to rest. There's a lot of reasons,
Yeah.
but. Look at your cute freckles. Look at her, she's like, I want it. You know you ate that one. She won't eat it out of my hand.
She probably never had treats. Poor girl.
You're not smooth mouth. That was so rude. That was super rude to say. Got the masses under her tail. I'm so bad at this. Oh, yes. See how I can't move her maxilla and mandible at all? Yeah, I'm not gonna She's got some ulcers on her. You guys want to see this over here? She's got a pretty sizable mass associated with her rectum right here. You see this mass right here? And then she's got a bunch more masses underneath her tail. So obviously I can't put my pathology eyeballs on and say 100%, but 99% of the time, something like that, that a gray horse has a bunch of tumors. It's usually melanoma, which is a malignant type of cancer. And what's tough is, when I see these in private practice, usually they show up as like a little pea-sized, like pencil eraser-sized bump underneath the tail. And the owner will go, well, that's not that big of a deal, but what we know based on these cases over time is that there are other masses often inside the body that we can't see outside the body. So it's not just, you know, some bumps under your tail aren't gonna bother you, but we know what cancer does to our bodies. So, let me talk to Nicole for a second.
So what are you doing, Liz?
I'm taking Coggins photos. These are also the photos that will go on their Facebook post for their naming.
I know. Based on that tiny peek, I have no idea how old this horse is. There we go. So I don't feel any of Galvani's groove. You feel?
No, I didn't.
Right? So that starts coming down at 10.
Okay.
So
I don't feel anything.
I'd probably call her 10.
What if you don't feel anything on this side and you feel something on this side?
Then you always go with the older tooth.
Okay.
Yeah, if you're like, this side looks like 10 and this side looks like 12, it's 12.
That's really not mania.
Looking for?
So this was an
probably braced,
aspiration
and she's
of
just probably
the
exhausted.
masses. And so it's already, you can see how black it is. So this is gonna be pretty easy to identify under the microscope that it
Melanin present
was
in tumors.
melanoma.
Yeah.
And this is on the big white horse?
Yes, that big gray percheron that Dr. Lydia had noticed all the rectal masses that she figured were melanoma. So we did a sample just to see under the microscope to confirm.
So you recommend removing both eyes?
Yeah, so the rule of thumb is if an eye is blind and non-painful, you can leave it in. If an eye is blind and painful and it might be able to see again, you leave it in and you treat it. And if it's blind and painful and won't ever see again, you take it out. In this mare's case, her eyes are pretty stable, but see how red it is all around her eyes? So that's called scleral injection. Her body fought the process of inflammation in those eyes for a really long time. So while she doesn't look like she's in an acute crisis phase, I don't believe there's any chance she'll ever be able to see again. And because she's only 10, if she lives to be 35 and her eyes slowly shrink over time, she could develop entropion. She has a corneal ulcer on one of her eyes, so you can still injure the eye even if you can't see it. And taking eyes out surgically is a surgery we do a lot here at Horse Plus. It's something that I'm capable of doing, and it would prevent her from having future problems. So it is something that I'm putting her down for, except in her case, it's not an emergency. Sometimes we're like, this eyeball is about to rupture and we have to take it out right now. We just finished up intake day for our buyout program up here in our beautiful quarantine facility. It's always a really tough day. We had 13 horses come in today. We had a bunch of donkeys and mini mules that were supposed to come that haven't come yet. So I'm a little concerned about those guys. Hope they're okay wherever they are in transit. But we are turning 3 out now to decompress into a quarantine pasture, which is always really rewarding. And I've got a full surgery schedule for tomorrow. We are able to accommodate some of those eye removals because we don't have a bunch more horses coming in. So often for our buyout program, it takes 2 full days for us to intake those guys. We got through everybody today. We're headed down to our hospital. We're gonna run a bunch of blood samples, process a bunch of samples, and start doing paperwork because there's a lot of paperwork involved. But overall, we have 5 of the 13 horses left still with us, and I'm really hopeful that all 5 of them will make it to adoption. Always a tough day to have to make those hard calls. And if you're watching this for the first time, for the record, we do a debriefing video. I'm gonna put my sunglasses on because I can't see it now. We do a debriefing video where I sit down on a couch and I go through medical records and talk about everything we found in each of these cases and kind of give the reasoning behind the decisions that we had to make. So if you're interested in knowing more and you didn't get what you felt like you wanted out of this video, that video will exist as soon as I have time. Probably won't be until next week though, because we're prioritizing those surgeries of the horses that need care. So we're headed down to the hospital now. I'm thankful that it's only 3:45. Sometimes it's like 7 p.m. by the time we're getting to this point. So.
Hey, thank you so much for watching this video. If you enjoyed it, please press the like button below. And if the little subscribe button is red, make sure it goes to white, so then you're subscribed to us. And there's also a little bell right next to it that you can hit that notifies you when we upload more videos. I appreciate y'all watching. Thank you so much.